So I learned about specialty pharmacy during my fourth year of pharmacy school when I did what we call an advanced practice experience here at Lumicera. I was so impressed with the culture here, the amount of care that these providers wanted to put into their patients, providers as far as the pharmacists, as far as other clinicians like nurses, working with other prescribers, other manufacturers. It was super important to me how invested everybody was in the outcomes of the patient. And I knew that I wanted to be a part of that process and to be a part of a high touch patient care model. Yes, so I'm a first year pharmacy resident. What's really neat is that I was able to obtain my licensure during the first couple months of starting here. I have gotten the opportunity to take top or disease state focused rotations. So I learn about things like oncology in depth for 6 weeks. Then I switch to other topics such as inflammatory disease states, leading into psoriasis, ulcerative colitis, Crohn's, everything in there. Then I switch on to growth hormone. I also get to work into the business end. So I get to spend time with the manufacturer programs, learning about enhanced services, opportunities we have there, as well as leadership, which is a very important part of the pharmacy field, how we can help to evolve things. So I get to really dive into depth of how Lumicera does all these different areas, if you will, that we practice. And then I get to partner as well with Namatis, learning more about our pharmacy benefit manager program and how we can help to collaborate with all these areas within the organization. What I love about working here is that it's not like your traditional sense with pharmacists where you get your 10-minute consult and then that's it. You say goodbye to the patient, you say good luck and hope everything's okay. Here, we get to touch points with them at multiple times. For we get to spend anywhere from, 5 minutes to 30 minutes talking with the patient depending on what their needs are. We want to make sure that they're comfortable and understand what the therapy is for. I also like that we are really working hand in hand with the prescribers. We work with the nursing staff, make sure that we have the up-to-date therapies that they're on, especially with like oncology. It's super important that we have those wonderful working relationships. And I like that we're really a part of that whole interprofessional team, which is really important to me. And the patients trust us. They've told me many times that when you're at an appointment, everything's coming at you 100 miles an hour, which is completely understandable. We get the chance after they've digested that information to really answer any follow-up questions they have and direct as appropriate. What I like about working for Lumicera is that they are super invested in me as a professional and personally. So they are wanting to help me grow. I have come all the way from being a fourth year student, just learning about specialty and what it was, to now progressing to be a resident where I am very involved in the organization. I like that they're interested not in only growing me, but they want to hear my feedback as well. So I get to have an impact on the organization and they listen to what I want to provide, which really means a lot. I like also that it's just beyond. They want to keep learning about what I want to do and how I can grow professionally and giving me and providing me with those opportunities. But most importantly, patient care is a big thing for me. So this patient care centered model where we do tons of touch bases, the monitoring, being involved in all points of the process from the prescription coming into the organization all the way to the prescription leaving and every touch point in between. We just get to help out and impact the patient's care so much, and that meant a lot to me. And that's why I like being a part of here.